कि नहीं बाजार दिया चले सरताज
ஆமா லைவ்ல
रे शशांक की रूम करा रहा
देख लिया कैमरा ऑन मेरे साथ में
क्या बेड हाँ
साथ फोन
చెల్లవైన మధు
ప్రీతి సెంథిల్ కుమార్ అంట
प्रवेश कर दो जाने ना
Professionals, hey.
என்ன லைவ் யூடியூப் ఏవా ஆடியோவே வரமாட்டேங்குது சார் ஏதோ சம்திங் ப்ராப்ளம் அப்படின்ற மாதிரி ம் ம் ஓகே ஆல் தி பெஸ்ட்
நம்பர் என்ன இத்தனை பேஜ் வருதாடா? புக்ல படிக்கிறேன். இதெல்லாம் ஒரு மேலும் முடிய மாட்டேங்குது. இப்படியில படிச்சுட்டு வாங்க டிவில படிச்சுட்டு அப்புறம் முடிய முடியுமா? டைம் இருந்தா அப்புறம்
ఫస్ట్
మడ్డ నా ఎందుకు వచ్చింది నీకేం మడ్డింది ఆగర్రా ఆపాలి మటన్
నాకు సెట్ కానప్పుడు వద్దనే చెప్పాలి.
అంటే ఏంటి
You were talking there by the class was going.
ఏనా
Hello. Good afternoon, everyone. Can you hear me now?
Sir, you are
Good
audible.
afternoon, doctor.
All
Yes,
right.
sir.
Okay. All right. Okay. Good afternoon. I'm sorry for the delay and having this problem with from my end. But today, this afternoon, first off, we would like to say a little prayer for our PMCH department chair, Dr. Anders, for her healing. And we do hope that we pray to our Lord that Dr. Audrey will be able to regain again her strength and complete recovery of her medical condition. Amen. Uh, this afternoon, we have three topics that we're going to discuss about. And this is something that might be also have to be taken previously. And most of the discussion here are quite practical or doesn't need to have an extensive explanation because this also had to entail some skills to develop over the years. But we will going to provide you the rationale or the reasons why do we need to discuss all of these things anyway. Okay, let's first discuss of the simple one. As we go on, it will become more and more in depth. Okay. Can you please confirm if you can able to see my screen right now?
Yes,
Yes, sir.
doctor.
Yes, okay. So why do we need to discuss about communications anyway? Why is it important for a doctor, not just in the preventive medicine, especially in the community health? Why do you need to communicate effectively? Can someone please type in the chat box? I'd like to develop a sense of engagement. I don't want to be talking here in front of you, whether it's virtual or face to face. Talking to myself, no? So why can you just participate? Oh, you don't need to do some doodling here. Okay, just type in the chat box your answer about communication. In any relationship, do you agree that communication is also one of the major factor if you want to stay longer in any kind of relationship? Communication.
బ్రేక్ తీసుకున్నాం
Hmm?
నాలుగు రెండు మేము పెళ్లి చేసుకున్నాం సార్ కొద్దిగా ప్రధాని
Establishing a doctor-patient relationship. Correct. Apart from that, you can start off a good relationship if you're able to communicate. Apart from that, why is it important for us as doctors, in particular, that we need to develop a sense of communication? Hmm? So there is a thing called rapport. And this rapport is something that is actually establishing a mutual respect for each other. When you come into your patient's room for the first time and he doesn't even recognize you, how can you able to establish rapport or how can you able to build the trust that has to be gained, no, from your patient? And that is what we call your establishing rapport, no? You need to develop that sense of trust and confidence in you, no? You would experience this during your clerkship and internship that most of your patients would not even bother to ask you your name or whatever because, or maybe they started to ask you many questions because they are in doubt. Are you really sure of what you're doing? Are you just practicing for my kid? So basically, you need to establish rapport because you want to gain their confidence and trust. And what way you can actually develop that is to have your communication. So how do you go about with establishing rapport? You need to have your self-confidence and demeanor. No? Once you come in, make sure that you are actually looking pleasantly. No? Make sure that you don't make unnecessary comments. You don't make unnecessary movements as well that put you or put your clients or your patients not too confident with you. You also need to understand and empathize and consider how your people would feel towards you. This is precisely the reason why we do not want you, no? We do not want you to get or interact with your patients just right then and then. You need to know why do you have to interact with your patients? Why do you need to explain to this patient why is it important for him to take his medicine? What is this procedure you are doing? Why do you need to take the blood pressure? A lot of things are actually being questioned, not because of just curiosity, but also understanding on how they feel towards it. If your question of question or manner of questioning, especially if you're taking history, might also be offensive. No, you need also to have that enthusiasm and passion. And sometimes at the end of the day, even if you are too tired monitoring your patient, this is how it is. No, so you need to establish that eye contact because you need to what? Penetrate that person, especially if you are extracting juicy or too personal information. No? May I also remind everyone that personal hygiene is very important in hospital. I would not stress this anymore anyway, but you should know by now that if you are going to be in the hospital, interacting with your patients, interacting with your consultants, how can I actually trust this person if he himself could not take care of himself? Appears to be too dirty, appears to be too stingy, with all the beard and all this. You need to be at your best also. No? Hygiene is a must for everyone here, especially if you are in the medical field. I am not sounding too racist or discriminating, huh? Especially Filipinos. Filipino patients are too particular with smell. You might hear some offensive remarks about how you smell, but this is how Filipinos are. We are too sensitive with smell. So you make sure that if you go to the patient, you will not offend him by your odor or how would you appear. Okay? Because I will not trust my kid. I will not trust my grandmother if this person could not even take care of himself. Or if this person doesn't know what he's doing. So you have to appear that you are interested in them. It's not just reading, okay, so what is your job? How many hours a day in a week? Or you are not robots. You are not machines. And you are not dealing with machines anyhow. You are dealing with people. You dealing them holistically. No, you approach and appear to them that you are really here, not just to learn from their case, to learn from what disease they have, but also to be empathic or compassionate about what they are going through. Communication is a series of experiences. It's not just how we talk, what we hear, it's even how we see, how we smell, no? And even the taste. It has a bit of a language, no? A sweet taste would mean a lot if you're going to give a sour and pungy or no or rotten food to a person because it's also a matter of communication. A sense of touch, you know, A simple touch of a doctor or a nurse would make a long way. If you go into the patient's room, ask him, "How are you, sir?" Do not do not mistake it from malicious touch. And sometimes patients doesn't want to be touched, so you need also to ask their consent first. No, or if this patient would grab on your head, doctor, I think I'm afraid. Is it too painful if you're going to inject that vaccination? Can you hold my hand? No, that is what we call your tender loving care. No, these things are not being taught in school, but this is innate. This is a character in yourself and how to become human, being humane to a lot of people. So you see, your communication, your smell can give also what? A signal. Why do you think women, most of the women would put sweet fragrances or cologne? To attract men. The same thing with men. It's not just the physical aspect, but even the smell can give you a sense of representation of that person. Do you want to be tagged as the stingy Joe or the stingy Kumar? Whose clerk is this? That clerk, the medical clerk is stingy. The stinky Kumar or the stinky Mohit. Do you want to be tagged as like that? Definitely not. So you better watch out your hygiene, huh? Especially if you're gonna be starting working in hospital. Or else you will be humiliated, not just by the patients, but even your fellow doctors, especially here in the Philippines. Huh? So communication is a dynamic process. What do you mean by dynamic process? It's actually a continuous flow of a process, no? And through this process, you convey a thought or a feeling to someone. Do you think my communication would be effective if I'll be just talking here alone, talking to myself? This is precisely the reason why I want some feedback. I am conveying a message. If I don't care if you understood me, or even don't care if you actually learn from this, then I would not just have to ask you for feedback, right? So that way, we could check each other. That's why I ask, am I audible? I send them a message, no, to Facebook, because I want a feedback, or else I'll be just wasting my time here, no? So it's a matter of a two-way process. If someone started to ignore you for some reason, especially in Facebook, you send a message multiple times and this person keep on ignoring you, and you could see that he was able to answer that messages. He has a lot of reason. Maybe he is doing something else. Maybe he was busy. Maybe you start to worry now. Why is this person ignoring me? Isn't it also not giving comment or not replying to a person is already a message? Would you agree? Yes, right? If someone started to ignore you, it it means something, no? And now recently, we also seen people who are ghosting. What is ghosting? This is a millennial term. This is your generation. Our days, we don't have this term as ghosting. What is ghosting? Can someone please type in the chat box what is ghosting? Hello? Hello, you are 500 here and no one is caring to answer me back or whatever. You see, I started to piss off again. You have a lot of ways to communicate with me, even this is virtual. I didn't even ask you to open your videos. I need an answer. Whenever I ask question, definitely I need answer. Yes, ignoring. What else? Ghosting is what? Totally avoiding contact. When someone cuts you off with all the communication without any explanation, that's really piss you off, right, Kyron? Especially girls. If that boyfriend of yours started to ghosting you and started to lose interest in you, how would you feel? You know, personally, I find it very ungentleman, especially if you're breaking off virtually. Okay, I decided not to see you again. I love someone. Goodbye. Thank you for the memories. You think that's gonna be enough for you to break off, to call it off? It's kind of unfair. And even women would started to ask some questions. What I have done wrong? Why are you now cutting me off? Is there any full disclosure or whatsoever? It's not just women, it's even men. In a relationship, especially in a romantic relationship, there should be communication because you're correct. Understanding with one another is very essential in a communication. In any relationship, there should be an understanding, right? Okay. You see, this topic is quite practical and doesn't mean any it doesn't take a genius to understand what we're talking about here. What I'm just saying is we can give practical situation wherein we can apply what we are talking here. So meaning it is how or it is received depends on the set of events, stimuli that the person are exposed to. Do you think you would understand me very well if I'm at the middle of the road and you could hear a lot of noises? No. Do you think that you would really understand what I'm talking if most of the time I am mad and angry? Or even your parents, you started to explain something, and the moment you talk to them, they started to shout. Because why? Maybe they are too tired already, or maybe they are what? Angry with someone else, and then they started to nag and argue, no? So you need to understand that this would depend on the number of factors, no? When we communicate, it's different and depends on also the person you're talking to. Try to call your brother or sister and ask him to okay, brother, let's take our dinner tonight. Mama is calling you. Okay? Your brother, a simple brother, let's eat. But try to ask or invite your friend. Hello, come on, guys. What are you waiting? Very casual. Sometimes you make fun of it, but start also to invite your loved one, your girlfriend. Sweetheart, let's go. Let's have dinner tonight. Right? So it depends also on that stimuli or particular emotions. But the message is just the same. I'm just trying to ask you to come and eat. But how you deliver and how it is actually being perceived would also matter. How you say what you say would actually play an important role in communication. What is this? How you say what you say. No? If you're going to say it with a hard face, no? With raising your eyebrows, with high pitched voice, it could actually give off another meaning. Yes, it would give off another meaning, no? Because communication would entail just part of speaking. Majority would be based on how you listen, the 45%. Reading and writing would comprise only of the 25%. No? Sometimes, even if we don't want to listen, even if we are listening to a person, but we already jump up with a certain conclusion, we tend to listen what we want to hear, not that person to say to us. It's different thing. I want to hear that you really cheated on me. But this person is telling you that he did not. But you already made your conclusion. No? And then we would probably say or argue, what do you want to hear? The reality, the truth, or what you want based on your conclusion? Because it's two different things. If I would say I did this, but in your mind, in your heart, I did the opposite, then there's no point of communication because you just wanted to hear, not what I'm actually going to say to you. That's why listening is very important. Sometimes, no, we tend to ignore people because of our emotions. Hmm? And sometimes we don't mean what we say we are angry. No? When we are happy, we tend to give all the positive. We tend to give all the promises when you are happy. But you forget all the promises when you started to feel bad towards that person. No? So don't make judgment if you are in your mood. If you are angry, if you are happy, don't make that judgment because you tend to be irrational. You know, a good friend is not someone who gives a lot of advices. A good friend is someone that has ability to listen to you without any judgment at all. And it takes some skill for someone to develop listening. In a world that everyone would like to speak up, everyone has a lot of things to say, especially that we have our social media, our own platform. Only few have this sense of skill of listening because it takes a lot of patience also to listen, right? So the level of communication, we have the verbal and the non-verbal. When we talk about the verbal, this is the word or the sound, okay? Intraverbal. The extraverbal is the implication of the words or phrases and how you actually also pronounce them, no? So if you're going to if for example, if you're going to say, how do you do? How do you do? How do you do? Okay, how are you? How are you? How are you? Okay. Sometimes we tend to be so confused if this person is asking or just stating a fact or opinion or maybe just verbalizing. Are you asking me or you're just telling me? Okay? Because of the intonation and the implication of the words or phrases. And even your diction, especially in India, wherein you have a lot of dialects, no? One diction or one dialect would be different from each other. So there is tend to be a bit of miscommunication and misunderstanding because of these differences, and especially also in the semantic. The nonverbal are the gestures, the postures, even the facial movements, no? The facial expressions are sometimes gives off also communication, no? Women tend to be offended if they feel they're being harassed, no? By a simple wink, no? By a simple gesture in the eyes, or even what, whistling or catcalling, something like that, no? So these are already non-verbal. And also the symbolic. When we say symbolic, it is a representation. There are no words, but there are figures. Say, for example, you see a cigar with an X like that, so meaning no smoking. So there are ways in which we tend to have miscommunication because of the barriers in communication that have to do with the communicator, the person who are sending the message. If that person is unwilling to say things differently, that would mean something. unwillingness to relate to others. I just want to say something. I don't care if you're going to understand what I'm saying. I'm just going to say this. Unwillingness to learn new approaches. This is how I talk. I always raise my voice. What's your problem? No? So, you see, this is on the part of the communicator. And that person, madam, may I take your blood pressure? I just need, even your stuttering, no? And this is sometimes difficult for those people who have that speech pathology, who had that speech problem because of the confidence that they lacking, no? You know, sometimes even the grammar doesn't need necessarily be perfect, no? Especially if this English is not your mother tongue. And people tend to be so conscious about it that they forgot what is really the message that they want to convey because they are so preoccupied in translating that into another language, no? You know, if you start talking in Tagalog, even if you are not really used to it, but you are struggling to learn Tagalog if you are in the Philippines and if you are talking to your colleagues, especially with your patients, what they tend to smile, they tend to laugh at you. It's not because you sound funny, no? For some people, it might be funny, but for some people, it's kind of kind gesture that you are exerting some effort to learn the language, right? Because that language, it's something personal also. Lack of enthusiasm, the voice quality. If your professor started to have or ask you recite in front of the class, and you are very nervous and you don't know exactly the answer to that particular question, what is the quality of the voice? Your voice tends to be softened, no? You don't want to be heard anyway because you are not sure of what your answer. But if you are outside the school and having fun with your friends, I could hear your voice from the corner to the other street, no? The voice quality also gives us a sense of what? Level of communicate, level of underconfidence, or level of excitement, or level of despair. That voice quality, it has emotions. Prejudice, no? You already come up with that conclusion. That's why I'm gonna say this to that person because it's not my level anyway. Something like that, no? Barriers in communication that had something to do with the communicator. Disagreement within the verbal, you are saying something and then your gesture says differently, no? That's quite confusing. How could a man convince that a woman she loves or she likes, no, to love him back, how would you convince a woman to love you back? Who is this person talking? How can you convince the one you are courting, how can you convince them to love you back? Can someone please chat in the chat box here? Those who have those who have started courting or dated someone or had a relationship before, how are you able to convince that girl to said yes? Hmm? I wish I could have the face-to-face with you right now, but unfortunately, I was not able to go to school. And I would like to see your emotions. And this is a very good topic, actually. How can you convince, guys? Can someone please type in the chat box here? How can you convince someone to go in a date by expressing love instead of saying words? How? Meda, Muktawali. You think the words are just enough? Okay, I love you. How do you say I love you in Hindi? How do you say I love you in Hindi? Open your microphone. Whoever want to say to ask to answer. Guys, come on. Are you bored? Because I'm starting to get bored with this class. By keeping her words and showing the actions. Yes. No? It's not just enough that you say that you like someone, but it has to be consistent also with what you are doing. How do you say I love you in Hindi? Or what your what are the love words that you can say to someone in India? In the Philippines, in Tagalog, how do you say I love you?
Mahal kita.
Mahal kita. And then in Hindi, how do you say that?
मैं तुमसे बहुत प्यार करता हूँ.
One by one. I could not hear, I could not understand. There are many ways to say I love you in India, correct?
Yes, sir.
Yes, sir.
Okay, can you give me one?
मोहब्बत है तुमसे.
प्यार है.
What?
मुझे तुमसे प्यार है.
Mujhe mushet mutyate?
मुझे तुमसे प्यार है.
Mujet munche mutyate. Another one, more simple.
मोहब्बत है तुमसे.
Moba?
मोहब्बत है तुमसे.
Mohabat mumuntese.
Yes, sir.
Am I saying it correctly?
Yes, sir.
Guys, this is live and recorded. I will find a way if you actually teaching me some bad or cursed word. I'll get back to you. If you said the other way around, okay, I will
Yes,
get
doctor.
back to
No
you.
problem.
Okay, so is it correct what I'm saying?
No, sir.
Okay, now going back, if that person has a negative self-image, no, and that person have a very low motivation and training, lack of feedback, I started to get bored if someone doesn't reply or answered me. So there is no feedback, and there is a language or vocabulary barrier. No, I'm not familiar with your or guys, come on. Mute yourself, huh? You're disrupting the discussion. Lack of self-awareness. No? Meaning he is not considerate of how others would feel about what she is saying. No? Lack of awareness, self-awareness. On the part of the receiver, okay, you have selective perception. You just want to hear what you want to hear. And you are unwilling to change. You are willing to change your behavior. You're not interested to the topic or subject. And also, you have this prejudice and belief system. You have this rebuttal instinct wherein every time that the person is talking to you, you have something to cut him off, argue with, or maybe question. Guys, if you are in an argument of a person, I have discussed this a while ago, no? If you are arguing with someone, you try to also decipher if this person is just talking based from his emotions, talking based from his observations. But if you are talking based from the facts and figures, you need to be also very you need to have some sort of discernment. No? If that person would like to convince you, you also have to know and differentiate, is this a fact? Is this a figure? Or is it just an opinion based on what he is want to believe? Because if I'm start to argue with a person and this person would like to tell us a lot and that person contradict to what I believe, say for example in the medicine, doctor, I think this herbal or this plant would cure the cancer and everything, blah blah blah. This is we use them in our provinces and everything. I would start to ask him, are you just stating it based on your experience? Is it supported by scientific facts or say even scientific study? Are there any local study that would support or any local data that could support your claim? Because I could not argue with you if it is just your opinion. Your opinion is true and valid based on yourself only. But if it is underwent series of investigation, even documented, even with supporting local data and all, then probably this can be accepted as a fact, no? And also personal value system. The external barriers in communications would, of course, comprise of the environment, the noise. That's why we easily get irritated with someone start to talk irrelevantly, especially in Zoom. Okay, at this moment, can someone, everyone, please open your video. I'd like to see all of you now. Keep your microphone off while your camera on. Okay, I'd like, please open the camera. You are in the gallery. I could see most of all of you in the gallery. Okay. So if you are in a physical condition where it is not comfortable for you to talk, high temperature, you feel very cold, or at sometimes you are feeling uneasy because you want to go to the toilet, no? So these are the barriers of communication wherein they can in fact disrupt the transfer of the messages. Other people could also disrupt your communication, status, education. The level of understanding is not really just based on the status, but on the comprehension. That's why if you'll be giving a lecture, a health education among common people, do you expect that they would understand interleukins, blood coagulation, aggregation? Can you actually explain it to them in a simple manner? So if you are going to communicate with your patients, especially if they are not in the medical field, you need to lower down, no, up to the level wherein they can understand you. Okay? 5 basic reasons we do not listen. Listening is actually a hard work. And there is a competition because everybody wants to talk. You want to go rush for action. Okay. I've got already. I have a limited time. I'm driving right now. I'm outside. Your voice has become choppy and everything. So there is a tendency for you that you don't want to listen anymore because of the quality, because of the differences, even in the speed. No, even in how you talk. When you're very particular, also with giving lecture. If we're giving lecture and they were just going to read your script as it is, okay, this class listening is hard work competition, the rest of action speed differences. How would you feel if I'm going to be talking like this way? No? You're not going to be interested. Lack of training. That's why if you start to give your talk, for example, you got invitation to give a talk in certain topic, you try also to practice. Guys, as doctors in the future, we are trained to be a public speaker. Regardless of whatever specialization you'll be into, once in your lifetime, or maybe at that frequent, someone will going to invite you to give a talk, to give a lecture. And you need to develop that sense of confidence at that as early on. And if you actually given the task to talk, try to talk in front of a mirror or in front of your audience, whether it's your family, your friends, and then ask them how is it? Or maybe you can record yourself and giving their lecture. So you could be conscious of what on how you deliver your talk. So there are levels of listening, no? We have the non-listener at all, the marginal listener, wherein they this marginal listener will have the tendency to what? They have the tendency to put you in just boxes. Marginal, meaning they want to classify or categorize. The evaluative listener, they tend to what? Always look behind or reading between the lines, no? Overthinking. And the active listener. The active listener is someone when to, he knows when to speak, he knows what to say, no? And he knows when to pause. Because if that person keeps on talking and talking, and he doesn't even bother to look how the listeners or how the audience would react, no? An active listener is also an active speaker, knows when to stop and knows when to listen. So how are we going to improve our listening skills? By not being preoccupied. For example, Talikota, Lokesh. Talikota right now is outside under the sun. Maybe he is walking, maybe he is trying to buy something or do something else. So he is listening at the moment. Now I got his attention, no? Because a while ago he was so preoccupied walking. Oh, I don't want to be blamed if this person will be hit by a car. Because instead of staying inside his house, he is outside. Or maybe that person is driving a car, no? And then listening or attending to his class. That makes you also put you in a very unsafe situation. So, if you are virtually attending, make sure that you are in a safe place, huh? Being an open-minded and non-defensive, meaning you take it constructively. If it is offending or you doesn't actually understood what you have listened, you can actually approach the person, minimizing interruption. Because there is only a limited times, a limited attention span. We tend to listen maybe in the next 5-10 minutes. And then after the 10 minutes, we tend our mind to flow elsewhere. No? That's why it's very hard for your faculty members or that speaker to get his attention, all the attention of the audience for the entire duration of the talk. That's why you have to see all your audience, even from the back, because you could really see them if they are started not to be interested. So you need to minimize the interruption, and effective listening is hearing, interpreting where necessary, and understanding the message and relating to it. Try to ask questions as well, because by asking questions, it would facilitate discussion, and it could facilitate and synthesize, process what we have already talked about. No? You know, it's very alarming if the class is very quiet and they doesn't even ask questions. Whether they really understood what you taught them, or they didn't understood at all. They didn't understand anything. They're just two. They did understood or they didn't understand any at all. 7% of the word are only labels and listener put their own interpretation on the speaker's word. Okay, hold on. Ay, hold on. Huh? Hold on. I just need to answer this one. Okay. 38% are considered the paralinguistic. The way in which something is said, the accent, the tone, the voice modulation. So this is very important to the listener. Okay, there are a lot of distractions, no? 55% are the body language wherein the what speaker looks like delivering the message would affect the understanding the most. Mute yourself, guys. So there are types of body language. You have your posture, the eye contact, the orientation. How do you position yourself? How do you want to lead that your presentation? What would be your appearance, your look, even the dress? No? If it's a formal talk, you need to be also in your suit. If it's just a casual talk, no, you need to also know your audience, your target audience, and the occasion. And what's the purpose of the talk? Because in that way, you can actually considering your people, the explosions of your emotions, the using of your facial expressions. So these are the types of body language that you could what give off by your body language. It could actually give 55% already of your message. Okay? So let's go to another topic. Any question at the moment regards to communication? Okay. Let's talk about the model of disease wherein there is this what we call your biopsychosocial model. There are types of human disease that we can be viewed at. You have your medical model, you have your epidemiological model, and you have your biopsychosocial model, wherein how the disease develop into something medical condition. So let's look at one by one. In a medical model, there is an emphasis on how you are want to treat. It's just really a matter of are you healthy or are you not healthy. The missing important dimension of the health is that the overall or the health well-being and even the social aspect, his environment are separate. For example, you are treating the person with antihypertensive drugs. You keep on giving, and that person keep on taking that antihypertensive drug. But start wondering, why is this person, this blood pressure are not going down? But he is compliant. Is there something wrong with this person? Or is it something wrong with his environment? You see, it's two different things. You keep on treating the patient with antibiotics, with anti-TB drugs. But did you also consider his environment, his ventilation, his water supply, his sanitation? So these are the aspects wherein we want to look into the biopsychosocial level. Address disease by may not be considered quality of life. So this is the health expenditure as a share in the GDP, wherein people, no, those people living in a country considered to be rich, no, and a country considered to be poor, they try to now look into how these people spend when it comes to health. So this is their expenditure based also how their country can able to provide health, no? When able to provide support. As you can see here, No? This is the GDP. So this is the difference on how they actually earn
Excuse me,
versus
sir.
how they act. Yes.
Sir, the new slide is not visible. The screen is still on the old slide.
Okay, hold
Old
on.
PPT. Okay, sir.
Can you see the slide now?
Yes, sir.
So we have
Yes,
your
sir.
medical model, you have your epidemiological model, and you have your biosocial model. On the medical model aspect, you just emphasize on the healthy or not. Hold on. Okay. So this is the graph of the health expenditure as a share of the GDP. It just tells us that there are certain countries in the world wherein they spend much of their budget to health. And this is also the life expectancy at birth. As you can see here, that Monaco, Macau, Japan are considered to live longer. Why do you think so? Basically, their lifestyle, no? Basically, it's not just a matter of these people, these countries are rich, no? But it's probably also their lifestyle. So by medical model standards, the US should have the best health and longest life expectancy. Why? Because they spend too much already in the health expenditures. So they need, expectedly, they have to live longer because they have a lot of budget. It's being spent in their health. In the epidemiological model, you are just looking into three aspects, no? The host or the person or the individual, the causative agent that might be the microbes, it could be the parasite, it could be the fungi, or it could be what? Mic- Microbes, no? And then the environment that makes it to develop the disease. So even if you have a healthy host, no? But the environment is so conducive for this disease to develop, then that person may be infected. Or if that causative agent penetrate directly the host, and that host have also make it conducive for the agent to to duplicate himself, replicate himself, then that disease entity would now develop. So the problems with disease model is will vary from individual, from one person to another. We'd expect that the younger ones and the elder ones would have lower resistance or lower immune compared to your young adult, right? Also families or genetics, we could see that diseases or the genetics would actually improve or deteriorate as the generations goes on because there are going to be mix of genes. So there's also one thing that we need to consider that disease can actually be passed or passed on. Now the problem with marrying your cousins or close relative, what would be the implication of that? And it's quite evident by science. How can you explain that if you're going to marry your own sister or even your own first cousin, what could be that health implication? You could see what? Can someone please type in chat box? Why do you think marrying your close relatives or even your close family members would have health implication or bad implication, bad health implications, would produce bad results in the offsprings. Why? Any idea, guys? Why? Let's talk about genetics, genes. Have you heard about the dominant and the recessive trait? The dominant and the recessive trait. Have you heard about it?
Yes, sir. Yes.
Can you can you explain to me, Gupta, Shivangi, what is this dominant trait? What is this recessive trait? And if those two persons would marry and have a child, what would be the offspring?
Sir, the dominant gene expresses itself in the progeny or in the genetics, while the recessive gene is that does not show itself unless and until it is paired with the same recessive genes.
Okay, very good. So if that dominant and the recessive would have an interplay or mix, even if that trait is recessive, it can be dominant to another as it passes on the genetics. Okay, hold on. Problems with your natural disasters would also give a rise of your communicable diseases as well, no? With this climate change impact, that would also affect, no, it's not just the behavior of our weather, but also how people would adapt to these natural disasters. Pollution definitely would have a high impact when it comes to the environment as well. And poverty. What do you think? Why do you think poverty is actually one aspect of disease formation? Why do you think poverty would contribute to disease formation? Hmm?
Sir, if one is below the poverty line, they would not have enough resources for treatment of diseases.
Right. Apart from the limited resources, these people cannot afford to go to hospital. Or say, for example, government will provide free services already, free medicines, free hospital. What else? They're already provided free, but still poverty is a problem in disease formation. The basic necessities, they are lacking. Even food, no, lucky for them if they can able to eat 3 times a day. But how about these people who doesn't make a good income, who doesn't even how to feed themselves, who doesn't have enough water supply, or even a decent house to protect them from the weather? No? So the poverty is basically one big problem. Other than that, why do you think the social or the things that we see in the environment would affect my health my health well-being? Why do you think the social or the lifestyle would affect my health or the disease formation? Of course, no? If you are fond of eating fast food, fond of drinking beers, or going to these places and all, no, you are harming yourself because these food are not natural. It would take some years for your body to synthesize and eliminate them. But if you keep on hurting yourself, insulting the cells, the integrity of the cells because of your exposing this to this hazard, no, unconsciously observe or even consciously, it would develop over the years. That's why hypertension, obesity, diabetes are not just genetically acquired, but also these are the lifestyle of the people. These are the choices he made over the years. Do you know that 68% of the known diseases to men are actually related to the food we take? Okay? So biosocial psychosocial model, health and illness are caused or influenced by many factors. The mind, the body are not separate. Relationships are significant to health, and health is a continuum process. From low level of wellness to develop physical, mental, emotional symptoms and change and group to the high level of wellness. It would have to have an interplay of your intellectual, your mental, your spiritual, your emotional, no, and the social being. That's why if you are dealing with a person who is actually depressed or having major depression, it's not just enough for this person to take his antipsychotic drugs, but also making sure that he has a good support system, right? He has a good outlook in life and also towards himself. So it's an interplay when you are dealing with psychiatric patients. It's an interplay, it's a multidisciplinary approach. The problem this day is that once people tag you having mental illness, they think that these people are crazy. You also have to remember that there are organic diseases wherein this person is in fact lacking that neurotransmitter in his body. That's why he is depressed. That's why he is acting like this. That's why his behavior is this. Because of that certain chemical that they may be inadequate. Or maybe there is problem with his metabolism. Maybe this person is depressed because that person is in fact having hypothyroidism. So it's not basically just coming from the brain. You need to go in the other parts or in other organs that can also affect the mental status of your patient. Okay? So that going back to the person who is taking the antihypertensive drug. He is taking the antihypertensive. But did you check the quality of his sleep? Was he able to sleep at least 6 to 8 hours in a day? Did you check the quality of the relationship that he has with the family? Did you check how is he during his work? Is he under stress all the time? With the deadlines, with a very bossy boss? No? So you have to look into this as well. Consider the biopsychological and social factor wherein relationships are actually significant to health. Patient and doctor, they always view us our partners, no? Partners to health. But please guard yourself that do not let your patients too dependent on you. You should also set the boundaries and limitations. You can only do much, but this patient has also to what? To uh, look in the other support system, such as the family, the friends, or even the co-workers. No? Doctors can only provide or do something, but the rest should be taken by the patient as well. Keep people healthy rather than wait to treat them when they become ill. That's why we are talking about prevention, because this is one thing that can actually be easily been taken for granted, but in fact, this is more important than curative. So the challenges in the biopsychosocial factor is that the poverty is an underlying issue, not just in the Philippines, but also in India and other developing countries because of lack of resources or education, lack of awareness, the behavior and their lifestyle, the misuse of antibiotics, no? Gaps or disrupted trusts in the immunization, lack of access to healthcare, and new diseases are emerging. So the biopsychosocial model, why we need to discuss this? Guys, you have to hold on. If you are going to do a research, okay, and if your research will talk about the biopsychosocial factors on a certain disease, you have to look into this to the following parameters. When you talk about the biology or the biological components of your target population, you need to give us the demographics, the age, the sex, the disease, the genetics, check the symptoms, what are the medications they are taking. So these are the biological composition. The psychological aspect would talk about the attitude, the beliefs, the behavior, even the spirituality, no? And how they view people or how they view life. That is the psychology. The environment talks about not just the place of residence, but also the communities living into the neighborhood, the impact of the social media to himself, the law or the regulations that are being imposed in that particular area, the health services available, no, the cultural norms, and the social aspect will now look into the support system, whether they are formal, if they are belonging to our organization, or which type of affiliation, what type of work he has, the physician-patient relationship he has, and even the socioeconomic status. Okay, so these are the aspects wherein you are going into look into the details. When you try to give us, especially in research, discuss the biopsychosocial factors of the disease in Kerala, India in 2010, during or maybe during COVID, what are the psychosocial models in COVID? Okay. Example would be among your audience who among them are having diabetes or doesn't have. Hold on. Family history, erectile dysfunction, or maybe in the psychology, it always back in my mind, there is some guilt or depression, the environment, the fast food are everywhere, secondhand smoking, in the social aspect, what are the marriage, he doesn't trust the doctor, the boss doesn't promote him, he cannot play with the grandkids, so these would have an interplay on the disease formation. What could be the difference between male and female, the fatigue, the joint stiffness in the psychology? Does it have any depression in the environment? Does it have a good access to healthcare? Does it have supportive family, or the husband is not very supportive. So these are your psychosocial model. Okay? The last topic that we're going to discuss is talk about your bioethics. Okay, you have your textbooks of obstetrics and gynecology as your references, and the methods and principles in biomedical ethics. So what is bioethics? This is an interdisciplinary field that examines the moral dimension of decision making when it comes to critical situation, no? Or critical decision making. Why? As a matter of life and death situation, which one we're going to choose? The mother or the child? Which one is the lesser evil? Which one would actually take precedence? Which one would actually be, that would not put you in situation that you're going to be very guilty about it all throughout your lifetime? Because one wrong decision that you're going to make would actually affect another life, right? So that's why we have to talk about this bioethics. So bioethics is a subset of ethics or laws that provides us reason and defensible solution in ethical principle for actual or anticipated moral dilemma facing the medicine, especially the clinicians and the biology. Bioethics deals with relationship between practitioners and patients, no, society and the patients, no. The four principles or the basic principles of bioethics are the principle of beneficence, principles of non-maleficence, principle of respect for autonomy, and principle of justice. The principles of beneficence would tells us that it is the obligation of the physician to give priority to the patient's welfare, meaning it should outweigh the benefit. It should outweigh the well-being of the patient. Do not cause harm, no, and provide competent health care that will maximize the health benefit. The principle of beneficence would support a number of more specific rules, such as to defend the right of others, preventing harm occurring for them, removing conditions that will cause the harm, help the persons with disability, and rescue the persons in danger. You see, we have a moral obligations, not just because you are doctor, but precise the being as a human. So when a patient is incapacitated by the grave nature of accident or illness, we presume that the reasonable person would want to be treated aggressively. That person want to be treated aggressively. You want to save the patient from dying. So we rush to provide beneficent intervention by stemming the wound, the bleeding, mending the broken, and suturing the wounded. I am not sure if you've seen the movie Forrest Gump, wherein Forrest Gump tried to help this captain from dying because his leg was nearly amputated. No? So he tried to tie it very, very, no, tie tightly, and that person was able to save by Forrest Gump. But eventually, that person went into depression because he lost his leg, and he blamed it to Forrest Gump, but only to realize that there is actually life waiting for him. That is what you call your principles of beneficence. Because I don't want you to die, because there's life still waiting for you. That's why I have to do this. I need to sacrifice one of your legs rather than losing you all. In the treatment of suicidal patients who are clear and present danger to himself, the physician should intervene on behalf of saving the patient's life or placing the patient in a protective environment in the belief that the patient is compromised or should or maybe was not thinking rationally, or cannot act in his own best interest at that moment. Another example, a patient comes to emergency room bleeding profusely from a gunshot wound, lost his consciousness due to blast with no other relatives in accompanying patient. So you need to do everything to save the patient, even if this patient came to you alone. A man came to the emergency room at 2 a.m. needing emergency treatment. You learn that this patient is the same suspect who killed a close relative to you few days ago. Will you treat the patient? So you are put in a dilemma wherein, yeah, you were put in the dilemma wherein a, a person's life is at your hand, no? But since you are a doctor and you are actually had also took this code and follow this principle, you have no choice. Even if it's actually going to be against your will, because you are doing your job as a patient, as a doctor. The principles of non-maleficence were in it requires the physician to prevent or minimize harm. The Hippocratic imperative to physicians, bring benefit and do not cause harm. For example, you check for the sensitivity prior of giving IV intravenous drug administration. You might causing harm even if your intention was good to give antibiotic, but you fail to check if this patient would develop allergy because you didn't do sensitivity testing first. You prescribe an oral antibiotic that you presume that he has no allergy. Okay? You refer the patient to a specialist who can manage it adequately because you cannot manage this on your own. And a severely diabetic patient infected with sex should undergo amputation rather than losing his life. Principles of magnificence would also support more specific moral rules, such as do not kill, do not cause pain or suffering from other patients just because you want to experiment into something. Do not incapacitate, do not cause offense. Please mute yourself. Hello. Okay, let's wait for him to mute himself. Tell that person to mute himself or kick him out. Are you done? Do not deprive others of the good life. Okay. Request for autonomy requires the physician to respect the rights of the patient to make decisions as an expression of self-determination. Their own body, their rule, so they decide on it own. However, the basis for the practice of this would have informed consent. They know what you would like to do to himself. They know the procedure. They know the consequences. No? They know that you're gonna be not held liable because you didn't force them to do so. So this is your informed consent, especially during procedure. Or what if the patient cannot sign? What if the patient needs to be operated and that is unconscious? Who would give the who would ask? Where can you get the informed consent to? The next of kin. If this person is married to his spouse, if this person is not married, his next of kin. Can that be his parent or that be his sibling? Okay? Principles of respect for autonomy would also include the following. You tell the truth, whether it's actually gonna hurt him. But there is an art of telling the truth. You also need to consider how it's going to be affected by your information. Respect the privacy of others. That's why it's threatened these days that the data privacy law is being implemented, not just in the medical records, in the entire workplace. No? So you don't post a picture of your patient that you had underwent surgery without the consent and with the full identity of the patient. You might be liable to that. If you notice that during our case presentation, we don't identify this patient, whether we use only his initials or you put black or you do not expose the entire face of your patient. Protect confidential information and obtain consent for interventions. When asked, help others to make decisions. But these are some examples, no? Terminal patient from a poor family decides to forgo self-sustaining medical technology, informing the patient about his prognosis. A VIP patient requests that his case should not be divulged in the media or his relative. Principles of justice. Justice in healthcare is usually defined as form of fairness, equality, or giving to each what is his due. The question is distributive justice also seems to hinge on the fact that some goods or services are actually short in supply, especially during the COVID, no? We need to prioritize. That's why you need what? You need to categorize your patient. Okay, who would be the first recipient of our vaccines? Those who are frontliner. And then next would be the elders. And then next would be the workers. Because of the short supply. Mute yourself, guys. Principles of justice also underlies concern about the social benefits and burden. For example, is it fair that the two patients, otherwise similarly situated, are treated this separately by the healthcare system because one is rich and the other one is indigent? So this is the reality, no? Sometimes we tend to give favor on those who can able to pay off. And that's the business side of your healthcare. And this is also happening these days. If you have money, you can easily find to have a kidney donated or liver for your patient. But if you don't have money, you should be on the line, on the long line, waiting for the right candidate for you to receive the kidney or the liver during transplant. You see, these days sometimes money talk, but in the principles of justice, there should be that case. Everyone should have an access. Everyone should be treated fairly. But in reality, guys, you would be bombarded with this sad reality. And you can only do much because sometimes these are just beyond your control. Okay, these are the principles, but sometimes in hospital, your directives are coming from your superior. So whether you actually accept the fact, swallow your principle, and go on with your life, or fight off with that principle, then it's up to you. What do you need to decide? Principles of justice are subdivided into three categories: distributive justice, right-based justice, and legal justice. Who should get first in an organ transplant? The first come first serve basis or the case-to-case basis? Should we recruit poor patient for your research just because they badly needed the money for compensation? So these are your things. So there are other biological or bioethics principle: human dignity, informed consent. Okay, I'm going to give you this anyway to your LO, so you will have your reference and you are given the examples already. Okay, so you have your four basic principles and you have your bioethical principles as well. Okay, and you're already given the example. I'm going to look into YouTube wherein there is actually a good explanation or scenario that discuss about bioethics as well. And I'm going to provide you also example. Any question at this point? We haven't discussed about euthanasia or mercy killing or even the abortion, no? But these are also, there are some legal impediments or there are some laws governing this kind of bioethics. Certain countries would allow, or certain states in America would allow this, but certain countries do not. So this is actually also debatable, no? If it's example, would you agree to have a therapeutic abortion, or would you agree to have an elective abortion if this would not?
అసలు మొఖం
Stop! A lot of people are competing with me. You want to talk? I'll give you the floor to talk. So annoying. Okay, so there are laws or regulations that governs this, no? And when it's not in the scope of this discussion anyway, but these are still highly debatable. Who would decide first? Is it the patient or is it the family of the patient? Okay, at the end of the day, it's not that the doctor who will always make the last decision. Sometimes, even if we're doing the last decision, we still have to consider what would gonna be the benefits for your patient, given that scenario, given that situation. Okay? And to guard yourself from the lawsuits, eventually that would actually come up with, there should be what? Communication. If you were able to communicate properly to the patients or to the relatives of what the procedure have done, why have you have done this, explain it them clearly by having established rapport and gaining the trust, then lawsuits will actually be avoidable. I believe those people who are actually being sued, or those doctors who have been sued, apart from the negligence or apart from the grave misdoing, it's not because they were not able to communicate it properly. Unless, of course, it's force majeure or it's quite obvious, no, that there is a negligence on the part. So that's why we have to know how to communicate with them effectively, and we have to know what are the factors that concerns in the disease development or why the patient is actually having that kind of disease. Okay? So by that, thank you very much for your attention. Next time, LO group leaders, I encourage you, if you have this kind of big class, even if virtual, make the other as a co-host. Avoid noisy students or interruptions by kicking them out or putting them in mute mode. Okay? The attendance of this session will be taken on the screenshot on those who are not attending live in YouTube or viewing them. Maybe they can chat in the comment section their full name and then their student number. So you can take a screenshot. You can take a screenshot of those who are in YouTube watching this. Those who are not able to attend the Zoom, please type in your student number and your full name in the comment section in YouTube if you are watching this live. The 3 slides will be provided to your LO for your reference as well. Not here in the Zoom. What I'm saying is in those who are in YouTube. Those who were not able to attend the Zoom because we have reached the capacity of 500 already. LO, please help each other to do a screenshot. That would serve as your attendance for today's session. Type in your student number in YouTube. In the YouTube, not here in the Zoom. If you're already in the Zoom, you don't need to type in your student number here because we can just easily download and screenshot. That's here. Okay, are we done? All right, okay, thank you very much. Okay, I'm going to leave now.
Thank you, doctor.
Thank you, doctor.
Thank you, doctor.
Thank you, doctor.
जय हिंद दोस्तों.